Good morning, everyone. This is our weekly COVID-19 update briefing on Thursday, September 24th. In Bossier Parish, as of about 9 o'clock last night, our positive cases are now 3,184. That's an increase of 217, which is the largest jump in a single week that we've experienced. That's twice what it previous large number was. So this could be partially as a result of the Labor Day weekend, but it certainly is an area of concern that we'll have to continue to watch statewide. We have encountered deaths now, a total of 106 deaths, which is an increase of 2. So that's encouraging, and we'd love to see it 0, and that's our goal. The Governor Edwards recently informed that the state has met the criteria to move into Phase 3, and that was done on September the 11th, and it was for a 28-day period to expire on October the 9th, or as extended by a subsequent proclamation or sooner, terminated sooner. The gating criteria has not changed, but the federal guidelines have a caveat that if local governors feel like the circumstances locally need to be tailored to the applications, they can do that. Governors can make things more restrictive than what is in the federal guidelines, but not less restrictive. So that caveat is available to governors. Well, while we are in Phase 3, that is indeed good news, but we cannot let our guard down. We should continue the prevention and mitigation protocols if we are to function effectively in Phase 3 and stay in this and not have to regress to a lower stage of the recovery. So what can we expect in Phase 3? Well, I outlined these in some detail last week, and they have essentially not been changed with one exception. That exception is that the governor has now changed the hours that alcohol can be assumed in a bar by 1 hour from terminating at 10 o'clock, now terminates at 11 o'clock. So it provides for the consumption of alcohol 1 additional hour, but the bar must still close at 11 o'clock. As previously stated, COVID-19 hasn't gone away. It's important that we continue face covering over our mouth and our nose when inside a commercial establishment or any other building or space open to the public, whether indoors or outdoors. It's estimated that 40+% of people are asymptomatic, but as we've mentioned every week, they can still spread the COVID disease and infect their family and friends and others, so they should comply with all the requirements whether they have displayed symptoms or not. So what can we do to save lives, improve our economy, and remain operating safely in Phase 3 as we await a safe vaccine? First, the governor stresses that it's incredibly important that we continue the prevention and mitigation protocols, which I've alluded to earlier. And they are unchanged. Wear a mask, wash hands for at least 20 seconds, cough into the bend of your elbow, do not touch your face, disinfect surfaces, social distance of at least 6 feet or more. If you're sick, stay home and follow the advice of your medical providers. And as always, it's a good idea to avoid crowds. Next, it's recommended that we all get a flu shot. Flu season is imminent, and it would be compounding the problem if we have a big flu outbreak at the same time we're going through this COVID-19 pandemic. So it is highly recommended by the Center for Disease Control and the local state Department of Health that we all get our vaccination for the flu. As mentioned last week, the effects of the Labor Day weekend are not clearly known, but our increase in the number of positives this 1 week is of concern to us. And the governor has stated that should the number of confirmed cases or the related hospitalizations be of such magnitude that it threatens the ability of our health care system to properly respond, it may be necessary to go back to phase 2 or phase 1. Hopefully that does not happen. On the issue of absentee voting for the November 3rd general election, I believe that has now been resolved. District Judge Shelley Dick has ruled that the elections will be conducted using the same rules and procedures that applied in the recent July and August elections. There will be some, with regard to absentee voting, as I mentioned, the broader emergency rules will apply, but there are exceptions which will continue to apply, and they are as follows. Voters in a medically necessary quarantine are an exception. Those experiencing symptoms or awaiting diagnosis, those caring for someone who is quarantined, those with conditions that could lead to a higher risk of contracting the virus, and it waives the requirement for in-person voting for first-time voters. So that's the general guidance for voting in our November 3rd national elections. Some legislators have expressed their concern that the governor's emergency orders are too restrictive and harmful to businesses. The governor has stated that he has followed the White House guidance and that of the Center for Disease Control, and that the significant impact the virus has had on Louisiana has dictated the mandates that he has issued. He has stated that from the very beginning of the emergency, he has relied on public health experts in the White House Coronavirus Task Force to provide Louisiana's response to this historic emergency. I suspect this issue of the governor's authority to declare an emergency will be discussed in the special session of the legislature, which is imminent. The governor has also stated that to abandon what we are doing in defiance of public health experts and federal guidelines would jeopardize the lives of people and the gains that we've made to date. And he cautioned that we not retreat and press on as we're continued as we have been directed to do. On a totally different subject, I would like to pass along some general information, and it's a very important subject, and it is filling out your forms for the census. Census takers cannot go day to day, door to door nowadays because of the COVID, so the completion of the forms is going to have to be online or by phone. And we're urging all our citizens to fill out that form. Why is it important? The census occurs every 10 years, and that count affects the following things locally. It affects the number of congressional seats we have. We, in fact, lost one congressional seat in the 2010 census, and we believe there was an undercount of our population, and we do not want that to happen again. But the designation of the number of congressional seats is one thing that's determined by the population count. Also, the funding for schools, hospitals, and roads is affected by our population count. Food security is affected. Community needs and neighborhood improvements and other things are affected. So it is extremely important that we all register for the census. It can be completed at www.census.gov. That's www.census.gov, or calling 844-330-2020. That phone number again is 844-330-2020. And this deadline for doing this is the end of September, which is imminent. So please complete your form if you haven't done so. Ladies and gentlemen, that concludes today's briefing. Our next briefing will be Thursday, October the 1st. Thank you and good day.